Ragwitek Tablet, Sublingual is used to treat certain allergies that may occur seasonally or year-round. It is made from extracts of certain plant pollens that can cause allergies. Before taking this medication, your doctor will need to do lab tests to determine what you are allergic to. This medication works by making your body less sensitive to the pollens that cause your allergies, such as ragweed and grasses. It may help relieve symptoms such as sneezing, runny/stuffy nose, cough, or itchy/watery eyes that are caused by allergies when taken as directed. It is important to follow the prescribed dosage and take it at the optimal timing for the best results. Before you start taking Ragwitek Tablet, Sublingual, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth without food as directed by your doctor, usually once daily. With dry hands, remove one tablet from the package just before taking. Place the tablet under the tongue and allow it to dissolve for at least 1 minute before swallowing. Do not chew or swallow the tablet. Do not eat or drink while the tablet is dissolving in your mouth and for 5 minutes after taking it. Wash your hands after handling the tablet. If needed, an adult should help a child take this medication properly. Watch the child for at least 30 minutes after each dose to make sure the child does not have an allergic reaction to the medication. For some brands of this medication, your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce your risk of side effects. Follow your doctor's instructions carefully. Usually, your doctor will direct you to start taking this medication about 4 months before the expected start of allergy season, and continue taking it throughout the season. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of Ragwitek Tablet, Sublingual include mild mouth/eye/ear/throat itching, throat dryness/irritation, cough, mouth/tongue swelling, or mouth blisters, especially during the first few days of treatment. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist. It's important to note that your doctor has prescribed this medication because they have determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's crucial to seek medical help immediately if you experience very serious side effects such as throat tightness/swelling, trouble swallowing/breathing, chest pain, or voice changes. A serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, seek immediate medical help. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. As for the daily dosage and optimal timing, it's best to follow your doctor's instructions. If you have any concerns or questions about the medication, it's important to consult with your healthcare provider. If you notice any symptoms of a serious allergic reaction after taking Ragwitek Tablet, Sublingual, such as flushing, rash, itching, swelling, severe dizziness, fast/weak heartbeat, or trouble breathing, seek medical help immediately. After taking this drug for the first time, you will need to stay in a healthcare setting for 30 minutes so your doctor can monitor you and provide medical help if needed. Your doctor will also prescribe another medication, epinephrine, to use if you have a serious allergic reaction outside the healthcare setting. Make sure to learn when and how to use your brand of epinephrine, and seek medical help right away if you have to use it. People with certain medical conditions such as high blood pressure, breathing disorders like asthma, or heart problems such as angina, irregular heartbeat, or previous heart attack may be at higher risk for a serious allergic reaction. It's important to inform your doctor about all the medications you use, including prescription, non-prescription, and herbal products. Before taking Ragwitek Tablet, Sublingual, it's important to let your doctor or pharmacist know if you are allergic to it or other allergen extracts, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other problems. You should also inform your doctor or pharmacist about your medical history, especially if you have breathing disorders, heart problems, high blood pressure, mouth irritation, esophagus problems, previous allergic reactions, or if you are currently undergoing any other allergy treatments. If you are planning to have surgery or a dental procedure, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Your doctor or dentist may advise you to temporarily stop treatment with this medication after dental surgery or a procedure. If you are pregnant, Ragwitek Tablet, Sublingual should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it's unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. Make sure to follow your doctor's recommendations for the daily dosage and the best time to take this medication for optimal effectiveness. When taking Ragwitek Tablet, Sublingual, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If you or someone else has taken too much Ragwitek Tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, while in Canada, you can contact a provincial poison control center. This medication is for use under the tongue, sublingual. Do not swallow the tablet whole. Allow it to dissolve under your tongue without chewing. Then swallow. Do not eat or drink anything for 5 minutes after taking this medication. Do not share this medication with others. It may harm them, even if their symptoms are the same as yours. Your doctor may direct you to also use other medications for allergy symptoms or mild side effects, such as antihistamines, nasal sprays for allergies. Ask your doctor for details. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take 2 doses to make up for the missed one. When storing Ragwitek Tablet, Sublingual, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to getting rid of any unused or expired medication, it's crucial to do so correctly. Never flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.